Hi, I'm Dr. Erin Ducat, a sports chiropractor with Ducat Chiropractic and Sports Medicine here in Bloomingdale, Illinois. Today I'm going to talk about a couple of common shoulder conditions that I treat here in my office that cause shoulder pain. The first is something called impingement syndrome. So this is where the scapula back here starts moving excessively on the thoracic rib cage and then creates a pinching sensation of the rotator cuff tendons here in the front of the ball and socket joint. You'll notice that you have pain kind of raising your arm up like this, out to the side. You may also have pain sleeping on that shoulder. This is one of the most common conditions that affects Americans. And the good news is that most of the time you don't need shots or surgery or medications to get better. We just have to restore the mechanical balance back to the area and the pain goes away. Another common condition is something called a rotator cuff tear. Now these come in both partial and full tear varieties, and this generally occurs when you've had an impingement syndrome for a long period of time, and that pinching and that impingement on that tendon just creates a lot of wear and tear until you start seeing small little holes, which would be a partial tear, and then sometimes it can fully complete into a full tear, thickness tear later on. Now, in the past, we used to think that you have to have the surgical repair of those tears in order to get full motion back to your shoulder. Now research is coming out saying that you actually get better outcomes, better results if you actually see a chiropractor, get physical therapy done, perhaps acupuncture to help restore the balance to the area. The last type of shoulder problem is actually something called a chromeoclavicular arthritis. So this is where you get more shoulder pain, like right in here, especially when raising your arms up overhead or pushing heavy weights overhead. It's very common in athletes. This occurs when there's too much pressure along that chromeoclavicular joint, right where your collarbone attaches to your shoulder blade, and then your body responds to that pressure by putting down extra bone over time. We call that arthritis. Now, there's no surgery for AC joint arthritis or chromeoclavicular arthritis. In the past, we used to prescribe injections for the pain, but now we're finding out is if you restore the mechanical balance to the area, just like with the impingement syndrome and the partial tears of the rotator cuff, you can actually get back a lot of your range of motion and lifting power without the pain and doing it naturally without drugs or medication. So this video is actually the second in a series of 4 videos about shoulder pain. So stay tuned for the next installment in which I'll show you some of the treatment options that we use for shoulder pain here in my office. And you can get a little taste to see if perhaps we can help you with your problem. Our website is ducatchiropractic.com, and that's spelled D-U-C-A-T. I invite you to check out our website and let us know if we can assist you in the future.